Welcome to KJR SummaryCast, audio summaries of peer-reviewed articles published in the Korean Journal of Radiology. This recording has been created and submitted by the authors and may have been generated using AI tools. While the article has undergone formal peer review, this audio has not been verified or edited by KJR. We encourage listeners to also refer to the published article for the most accurate and complete information.
Okay, let's unpack this. Imagine piles of crucial medical reports. The detailed findings from scans holding keys to huge decisions like whether cancer can be surgically removed. But these reports, often free text, different styles, sometimes even mixed languages, makes them really hard to process consistently.
Yeah, a real challenge.
So we're diving deep into a research paper looking at cutting-edge AI, specifically models like GPT-4, and seeing if they can tackle this exact problem for pancreatic cancer report.
Pancreatic cancer, PDA,
Yeah.
It's such an aggressive disease. Getting those treatment decisions right and fast is absolutely vital.
Right.
And figuring out if surgery is even possible, assessing resectability, as doctors call it well, that hinges massively on interpreting those imaging reports, usually CT scans.
Exactly. And you mentioned the core issue, variability. Even when there are standard templates out there, like from the NCCN, the National Comprehensive Cancer Network,
Which are great guidelines.
the actual free text reports radiologists write can still vary quite a bit.
They really can. And that inconsistency, plus just the sheer volume of reports, it creates a bottleneck.
A bottleneck for what, exactly?
Well, it makes it incredibly hard to use all that valuable information consistently.
Yeah.
Think about building medical databases for research or even just for quality checks. It's tough.
Right. So our mission here, this deep dive, is to figure out if AI, like GPT-4, can actually cut through that complexity. Can it pull out the key info, maybe structure it, and this is the big one, accurately judge if a tumor is resectable just from the text?
That's the million-dollar question the researchers were asking. They saw this gap.
Yeah.
We have good NCCN templates, clear criteria for resectability,
Sure.
but in the real world, with busy clinics.
They don't always get applied uniformly.
Exactly. Radiologist preferences, workload, lots of reasons.
And that inconsistency isn't trivial. It affects clarity for other doctors reading the report, right? And makes getting data out a huge manual chore.
Precisely. Structured reports are just much better for clarity, consistency, and pulling data from them. Way easier. Essential for building those research databases we talked about.
But converting all the existing free text reports, especially historical ones, into that structured format, that sounds like a massive job.
Oh, it's incredibly labor-intensive.
Yeah.
And you need expert radiologists to do it properly, and they're already stretched thin.
And I guess older computer methods didn't really crack this, the ones based on simple rules.
Not really, no. Radiology reports just have too much natural variation, phrasing, terms, sentence structure. Those rigid rule-based systems weren't flexible enough.
Okay, so this is where the large language models, the LLMs, come in, like GPT-4.
Exactly. These models are built to understand natural language. They're much better at handling different writing styles, nuance, and crucially for the study, even reports with mixed languages. That adaptability makes them seem like a good fit for this medical reporting challenge.
All right, so this specific study in Korea, how did they actually test GPT-4? What was the setup?
So they took free text CT reports for pancreatic cancer, some just English, some a mix of English and Korean, and tasked GPT-4 with turning them into structured reports based on NCCN guidelines. And importantly, they also checked if the AI could then look at those findings it extracted and correctly determined the tumor's resectability category.
And this was real-world data.
Yep, real reports collected retrospectively from 2 hospitals in Seoul St. Mary's and Yunpyeong St. Mary's. They used 2 AI versions, GPT-4 Turbo and the newer GPT-4o.
So did they just feed the reports straight into the AI?
Not quite plug and play. They did something called prompt optimization first. They used reports from one hospital to fine-tune the instructions, the prompts they gave the AI.
Like teaching it exactly what to look for and how to format the output?
Exactly. They tailored it to extract info based on a customized NCCN structured template. Once they had those instructions dialed in, then they tested the models on a completely separate set of 115 reports from the other hospital.
Got it. Keeps the testing fair. And how did they know if the AI got it right? What was the comparison?
They needed a gold standard. So a very experienced abdominal radiologist, 15 years experience, manually reviewed those same 115 test reports. That radiologist converted each one into the structured format and determined the resectability. But crucially, using only the information present in the original text report, just like the AI had to. That manual review became the benchmark.
And I know these AI models can sometimes be a bit random, give slightly different answers sometimes.
That's true. There can be some variability.
Yeah.
So to account for that, they ran each report through the AI models 3 times.
Yeah. Okay.
And the final answer for each report was the result that came up most often in those 3 runs. Sort of a majority vote to smooth out any randomness.
Smart. Okay, so the tests are run, the comparisons are made. What did they find? What were the headline results?
Well, it's quite interesting. For the basic task, just generating the structured report, pulling out the data points, both models did pretty well. Acceptable accuracy.
How acceptable?
GPT-4 Turbo got about 92.3% of the items correct, and GPT-4o was right behind at 92.2%. Statistically, no real difference between them on that structuring task.
Okay, so pretty decent at extracting the individual pieces. But the really critical part, judging resectability, was it the same story there?
No. And this is really the key finding. When it came to
Okay.
classifying the tumor's resectability based on those findings, there was a significant difference.
Oh,
GPT-4 Turbo was accurate 81.7% of the time, but GPT-4o only 67.0% accurate.
wow, that's a big drop, especially for the decision that could determine if a patient gets surgery or not.
Exactly. So similar performance on structuring the data, but a noticeable gap in interpreting it for that crucial clinical question.
Any other standout findings? You mentioned mixed language reports earlier.
Yes, that was another fascinating point.
Uh,
The models handled them surprisingly well. Accuracy for pulling out key items from English-only reports was pretty similar to reports written in both English and Korean.
so they weren't tripped up by the language mix.
Not significantly for the basic extraction, no. And actually, for the resectability assessment, GPT-4o, the one that did worse overall on resectability, performed significantly better on the mixed language reports than the English-only ones in the test set.
Really? How much better?
It was 74.0% accurate on mixed language versus only 31.6% on the English, only for resectability. It suggests these models have real potential in diverse multilingual settings, even if there are other factors at play.
Were there specific things in the reports that the AI struggled with more generally?
Yes, definitely. Accuracy dipped for items like describing the tumor's appearance, finding liver lesions, identifying suspicious lymph nodes, and noting other extrapancreatic disease.
And why do you think that was? What makes those harder?
Well, think about it. Those are often areas where the original reports use more ambiguous language, subjective descriptions, things that aren't as clear-cut as, say, a measurement.
Right, like describing appearance can be quite narrative, less standardized.
Exactly.
Yeah.
It's harder for the AI to reliably interpret that kind of information and map it neatly into a structured field.
Whereas things like tumor size and location, I bet accuracy was high there.
Spot on. For those clear, consistently reported items, accuracy was very high, often up in the high 90s. It really highlights that the quality and clarity of the input text matters a lot for AI performance.
Makes sense. So when the AI did make mistakes, what kind of errors were they seeing?
They fell into a few buckets. Sometimes the AI seemed to misunderstand ambiguous data that was in the report. Other times it might hallucinate, basically make up data that wasn't actually there.
Oh, right, hallucinations.
Yeah. Or it might misreport data that was present, maybe get a detail wrong, or simply omit information that should have been included.
And for the resectability error specifically, what went wrong there?
It could be a couple of things. The AI might have made an incorrect judgment about really key factors, like whether the tumor involved major blood vessels that's critical for surgery, or whether the cancer had spread, metastasis.
So it might have extracted the wrong facts about those things.
Potentially. Or it might have extracted the facts correctly, but then misapplied the complex rules, the criteria, for determining resectability. It's a multi-step interpretation.
And going back to that difference between Turbo and 4O on resectability, did the researchers offer a reason why Turbo did so much better there?
They did suggest a possible reason. Remember the prompt optimization step?
Yeah, where they tuned the instructions.
Right. That optimization was done specifically for GPT-4 Turbo. So even though GPT-4 is newer, it might not have performed as well on that specific complex task because the instructions weren't perfectly tailored for it.
So prompt engineering is really key, especially for these high-stakes interpretations.
It seems so. It's not just about having the latest model. It's about how you guide it. Interestingly, they also noted GPT-4o was more likely to say a case was not accessible, perhaps reflecting more uncertainty when the prompts weren't perfectly aligned.
Okay, so pulling this all together, what's the big takeaway from this study, this deep dive?
The main conclusion is, well, While these GPT-4 models show real promise, they can generate structured reports from these messy, mixed-language free text narratives with fairly good accuracy overall. But human oversight by expert radiologists is still absolutely essential.
Especially for that crucial resectability call.
Precisely. That decision has such direct impact on patient treatment planning, and the AI's accuracy, even at 81.7% for the better model on that task, isn't quite at the level where you'd want it making that call unsupervised.
Yeah, I can see that. It feels like this study fits a pattern we're seeing elsewhere with LLMs in medicine. Huge potential for processing text, structuring data, even crossing language barriers.
Absolutely. The potential for efficiency for building better data sets from historical records is enormous.
But it also clearly reinforces the need for that human expertise, for interpreting the nuances, handling the ambiguities, and making the final critical clinical judgments.
Exactly. The AI can be an incredibly powerful assistant, maybe handling the first pass of data extraction and structuring.
Saving radiologists time on that front.
Potentially, yes. But the ultimate interpretation, so what does this mean for the patient? Especially for something as complex as resectability that still needs the human expert.
His whole deep dive really highlights the potential, doesn't it? Tackling information overload, inconsistency, even language gaps in medical reports. You can really imagine the efficiency gains, the research possibilities, if we could reliably structure all those old free text reports.
The potential is definitely there, building rich, usable databases from mountains of text. It's tantalizing. But as this study shows, we also need a clear-eyed view of the limitations right now, especially when the AI moves from processing information to interpreting it for critical clinical decisions like surgery.
It seems like AI can be a powerful co-pilot, handling a lot of the data wrangling, but the human expert still needs to be firmly in the pilot seat for those ultimate calls.
It feels like a good summary of where things stand based on this research.
So it leaves us with a really important question, one for you listening to think about. As AI keeps getting better and better at processing medical information, how do we strike the right balance? How do we best leverage its undeniable efficiency while making absolutely sure that human judgment, that irreplaceable expertise, stays central to patient care? Where do you draw that line?